This is the card. Go through this card. We are going to participate in a debate. You have 3 minutes to prepare. 3 minutes for preparation. Open debate. Written format. This is a home visit. This is a home visit. Study the question carefully. We'll respond to each point very carefully. First one, the introduction. Then 1, 2, 3, 4, 5, 6, 7 points. 7 bullet points. Then the conclusion. Yeah, speaking points. We are going to discuss speaking today. Study the question very carefully. No need to hurry. We'll see how to analyze the points here. We'll learn quality sentences. Very good. Geeta Jayakumar. Geeta. Good morning. I am Geeta, one of the registered nurses working in the community health center. If I am not wrong, is it Mr. Wilson's home? Is it Mr. Wilson's home? Okay. Can anyone hear me? Yes. Yeah. So let us see how these sentences will be talking. Good morning. I am Geeta, one of the registered nurses working in community health center. If I am not wrong, is it Mr. Wilson's home? Wilson. If I am not wrong, is it Mr. Wilson's home? No, that is not right, Geeta. If I am not wrong, this is Wilson's home. Okay, we'll check it out. Yeah, write your introductory sentences. Please submit your introductory sentences. Please submit your introductory sentences. Please submit your introductory sentences. Good morning. Is it Mr. Wilson's residency? Residence. I am Srija Ravindran, one of the registered nurses working in the community health center. Am I talking to Mr. Wilson? Is this the apt time to have a talk? Yeah. Deepika Satish. Good morning. I am Deepika, one of the registered nurses working nearby your community health center. Is this Mr. Wilson's home? No, Wilson's home. Is this is the right time to talk to you? Is this the right time to talk to you? Sukhvinder Kaur. Good morning. My name is Sukhvinder. I am one of the registered nurses in the city clinic. Is this Mr. John's house? Okay, can I come in? All your sentences. All your sentences. Yes. So all these sentences we'll take and we'll discuss. The complete points we'll discuss. Every sentence we'll discuss. All the students' sentences we'll discuss. Yeah. Then I will tell you. Yes. Come on in. I am Mr. Peter. Please have your seat. Yeah. Come on, all of you. Type all your sentences will be corrected at the end. Good morning. My name is Hafsa Fatima. I am a nurse from Community Health Center. Could you please confirm me if this is Mr. Wilson's house, as I am here to check on him today? Yeah, come on, come on. All of you participate, actively participate. Be on fire. Be on fire. Oh, you want to see me? So you'll be on fire. Come on. I'm full of fire. I'm the commander. You are my soldiers. Shoot your bullets. Okay. We had a doctor who got the first attempt result today. His name is Mohammed Said. All these sentences, everything which is by at the end of the session, everything which is okay. First point, introduction is over, suppose. Then go to this. Okay. Yeah. Go to this point. So bullet point number 1. So we are going to bullet point 1. Okay. Compliment the elderly client on the positive and unselfish attitude. So what I am going to tell you here, compliment the elderly client on the positive and unselfish attitude, because I am telling you what. Yeah, I am. What is the sentence? Let me tell you. I am happy to go into care so my family can have a pleasant and worry-free trip. This is my sentence. Okay. So Mr. Peter's sentence. Mr. Peter's sentence. Okay. He's telling like this. I am happy to go into care. I am happy to go into care so that my family can have a pleasant and worry-free trip. I'm happy to go into care so that my family can have a pleasant and worry-free trip. Come on, participate actively, dynamic. All your sentences. Good afternoon. My name is Avil. I am a community health nurse. Is this Mr. Wilson's house? It's a question mark. Is this Mr. Wilson's house? Question mark. Okay. Good afternoon. My name is Abel. I am a community health nurse. Is this Mr. Wilson's house? Mr. M capital letter W capital. Okay, don't need to worry. I'll correct all those things afterwards. Don't worry. Yeah. Compliment the elderly client on the positive and unselfish attitude. Yeah. So I'll be talking like this. I am 90 years old. I have lived alone fairly independently for many years in a unit on my daughter's property. Okay. So I am 90 years old. These are my sentences. Okay. I am 90 years old. This is my sentence. I have lived alone fairly independently. These are my sentences. You can take my sentences and you can respond it accordingly. For many years in a unit on my daughter's property. I have lived alone fairly independently for many years in a unit on my daughter's property. My daughter's family are going overseas for 2 weeks and 2 weeks. Right. I am going to a lovely. I am ready to go to this. I am ready. I am ready to go to a lovely retirement home. Yeah. I am having, okay. Yeah. I am totally, I do not want to be a hindrance. Okay. I do not want to be a trouble to my children, my daughter. I do not want to be a trouble to my daughter. Okay. Only if I go there, they will, otherwise they'll be bothered. If my daughter is bothered, how I'll live alone here. So that's why she's arranging me this retirement home stay. So if I, they will not be very happy. They cannot have a happy trip. I want them to have a lovely trip. I want them to have a lovely trip. Okay. They will enjoy the trip only if I am comfortable. Yeah, whatever. Come on, you write your sentences. How are you going to compliment? That's a really wonderful decision. That's a really wonderful decision. It's so nice of you to accommodate your children. So write down your sentences. Compliment on the elderly. Give a compliment. Give wonderful compliments there. All your sentences will be corrected, please. Yeah. Now next bullet. Your, so how the patient, nurse, how does she speak? How does the nurse speak now? You're very sensible regarding the pleasure trip of your children. That's very good, Sani Habibullah. You're very writing very nice sentences. That's a wonderful decision. I would like to commend you for your attribute. That's awesome. Being unselfish is not an easy attribute to come about. I would like to emulate such attribute of yours. That's very good. Wonderful sentences. Wonderful sentences. So you believe that only if you are comfortable, your children will can have a pleasure trip, have a wonderful trip. Okay, they can enjoy their trip. That's the reason why. So I appreciate to hear the amazing decision from your side. That's good sentence. Your decision is extremely commendable. Your decision is extremely commendable. Your decision is extremely commendable. Short and sweet. Come on. Next bullet point 2. Bullet point 2. Reassure the client of privacy and flexible house rules. So I'm going to ask you the point here. Okay. I am not going to compromise on my independence under any circumstances. I'm not going to sacrifice I'm not going to compromise. I'm not going to compromise on my independence under any circumstances. There's no way, right? I am worried about I'm worried about lack of privacy. Okay. I'm worried about lack of privacy. I do not like rigid timetables. Yes, come on, give your sentences. Give your sentences there. Sorry, that is rigid timetables. Rigid, R-I-G-I-D. Yeah, go ahead, shoot your answers. Be active, dynamic. You cannot feel at home in our care. Your comfort is our fundamental priority. Come on, respond to this question. Bullet point number 2. Reassure the client of the positive and unselfish attitude. Reassure the client of privacy and flexible house rules. I can certainly understand your feelings. However, I can reassure that your privacy will be respected there. I really appreciate Hafsa. I really appreciate you for being selfless all the time. I must tell you that you have taken a fantastic decision to move into our care. Yes, that's good. You need to have this in mind that we will ensure that your privacy, that is coming too many times, will be that your privacy will be maintained. Here is just like a home away from home. Wow, very good sentence, Habibullah. Yesterday, the person who referred, what's the name of the person? I forgot. It got doesn't names I forget. I don't know. Everything I'll remember, the names I'll forget. Who is the one who referred? You. She was telling me, Habibullah, you never put me down. Awodir Fulake. Awodir Fulake, yeah, from Nigeria. So she was telling me, you never put me down, sir. How many students I sent every time you give the best possible training for the students. Okay. Yes. She was telling about me, about you. So, right. Here is just like here is just like here. It is just like here. It is just like home away from home. Consider this as your second home. That also you can say house rules. The house rules are so flexible. So flexible. So will come with a that. So house rules. The house rules are very flexible. And not rigged. Okay. Come on, write down your sentences, all of you. Don't be passive. You have to learn number of things. Okay. Okay. There is nothing to be alarmed about it. We all are here to support you and we'll take all the precautionary measures to keep you safe. Wonderful. No mistake. Okay. There is nothing to be alarmed about it. We all are here to support you and we will take all the precautionary measures to keep you safe. I think better you switch on to the passive voice. You are doing very correctly. Now, if you see people are writing incorrect sentences, then I will tell them. But you are writing very correct sentences. You can switch on to the passive voice. Okay. So you can say like this. All the precautionary measures to keep you safe will be taken. All the precautionary measures will be taken. We will take. The precautionary measures will be taken. Sukhwinder, you can feel the homely environment in our care home because your concern and privacy are our topmost priorities. Concern and privacy, plural. You will feel elated over there with our team members. Only one member is there? Then how it can be team? Sukhwinder Kaur. Come on, come on, come on. Bullet point 3. Explain the home's philosophy, making clients feel at home, respecting wishes, unrestricted visiting hours to meet quality of life desires, etc. Yeah, I am highly independent. Okay, so I do not like too many restrictions. I have my own uh, doubts regarding your care home. Can you please provide me the services and the care you provide, care you offer? Yes, come on. Come on, write down. Bullet point number 3. What is the home's philosophy? Write about sentences. All your sentences I'll improve and give better sentences. Don't worry. Write down whatever comes in your mind, you write down there. The residents of our care home will be treated with a special attention. Write down your sentences, please. The visiting hours are flexible. Don't be passive. Come on, write something. If you write only, I can improve. Nah? Write whatever you feel like. I'm going to correct each and every sentence. I really appreciate your concern. That's good sentence. So I really appreciate your concern. Instead of that one, you can say, your concerns are commendable. Your concerns are appreciated. Your concerns are reasonable. Good. Come on. One sentence you write at least. If you cannot write full, yeah. Every organization has their philosophy. Our home's philosophy is tailored, not or tailored. Philosophy is singular, so is tailored to allow our clients to feel at home. This includes giving priority to the client's wishes, and our visiting hours are not fixed. It gives room for great desires of life. Very good, Sani. You have a good flair of writing. Your style is little good. And not it's better. Not just good, it is better. That's a genuine question from your part, not from your part, on your part, or from your side. That's a genuine question from your side or on your part. On your part. Yeah, all these sentences you'll get. Geeta Jayakumar, you no need to worry. You no need to worry. You need not worry. Why? What is this? You need not worry. There is nothing to worry, Mr. Wilson. We are here to make you comfortable. This you, forget it, Geeta. Forget this you. Okay, it will be considered as two mistakes. Okay, you and you. Already two mistakes. There is nothing to worry. We are here to make you comfortable. You can feel as if you are at home. Mr. John, don't worry. I'm here to explain everything to you. Yeah. So if I am there, let me tell you, that's really wonderful to share your feelings, Mr. Wilson, Mr. Peter. Thank you for sharing your feelings and concerns. Somebody write down these sentences in your notebook and afterwards type them. Okay? Thank you for sharing your concerns and feelings openly, Mr. Peter. Thank you for sharing your concerns and feelings openly, Mr. Peter. Thank you, Geeta. Whatever your points are, I'm going to make a note of all those things. And we'll definitely see that. Yeah. All the points that you are going to discuss with us, we are going to make a note of them. And we'll definitely implement to the level of your satisfaction. As far as possible. Next, bullet point 4. Ask about his her daily routines. For a better understanding of your daily routine, your lifestyle patterns, and your dietary regimen. Would you please provide us information regarding your regular daily routine? For instance, your sleeping patterns, your dietary regimen, and in case anything else which is important, can you please give us the details? Come on, write your own sentences. You can kindly brief us regarding your normal daily lifestyle, especially regarding your food habits. For instance, you're a vegetarian or a non-vegetarian. What are your preferred food items? Would you mind telling me, when you say, would you mind telling me, that is not needed. Would you mind telling me your day-to-day activities? That what is will go off. For instance, sleeping patterns and food habits. Well, would you mind providing me some valuable information, vital information, basic information regarding concerning related to your dietary regimen? Yes. So nice of you people. You're writing very nicely. Participation is good. I'll take the entire discussion chart and put it on in the document and then correct them for you. That'll be for your comfort. Can you provide us information regarding your dietary pattern and your food habits to make your stay sunny, to make your stay worthwhile? Very good word. To make your stay worthwhile. Very good. I would like to ask you about your sleeping habits, meals, and if there is any allergic, no, if there is any allergy. Geeta Jayakumar, would you mind, on is not needed. Would you mind giving information about your dietary patterns and sleeping habits? You can use not only but also. Would you mind giving information about dietary, not only dietary but also sleeping habit, dietary pattern but also sleeping habits? Good. I'll improve the quality. I'll definitely improve the quality. These are your sentences. Okay, they are good. They are better. These sentences are good, better than, for example, there are many students who are not writing. They are not practicing. These sentences are better than, okay, not writing, right? So I'll definitely give you the best ones. Yes, go ahead. Bullet point. 1, 2, 3, 4, 5. Bullet point 5. Highlight the fact that you are noting his/her usual daily routine in your care plan. Whatever you are mentioning, everything, I'm noting them down in your care plan, your daily routine, your requirements, food requirements. Would you like to provide us information about your dietary pattern? Would you like to, Dalvi, don't write you, write YOU next time. Would you like to provide us information about your dietary pattern, sleeping pattern, and any allergic conditions? Good, good, good. See, many students are giving sentences. All those sentences you can learn. Eh? Would you like to provide us specific information regarding your or about your dietary patterns, sleeping dietary regimen, sleeping patterns, and any allergy conditions? Good. Yeah, many people have left. Only 8 are there. Okay, no problem. Don't worry about the others. Would you mind giving information about dietary pattern as well as sleeping habits? It will be helpful for me to make note of it and provide appropriate advice to you. Good. Bullet point 6. Ask about his/her medication regimen. Are you under any specific treatment plan? Are you undergoing or are you taking any medications? Is there any ongoing medication? Ask about his/her medication regimen. Are you currently taking any medicines, tablets, or injections? Are you undergoing any treatment for any medical condition? Your daily routines are adequately noted. Very good. Passive voice. Very good, Sen. Your daily routines are adequately noted. They will be used to formulate your care plan. They will be used, passive voice, to formulate your care plan. Delvi, Peter spelling is P-E-T-E-R. Okay. They will be used to formulate your care plan, which is individualized, which is an individualized document. Mr. Peter, do you have any ongoing medication which you are taking on a daily basis? On a daily basis, which you are taking on a daily basis. Medication, comma, which you are taking on a daily basis? Yes, good. Bullet point 07. Bullet point 07. That's great. Full stop. Are you taking any medication currently? Question mark. I would like to know when and how you take your medications. That's good. Summarize your discussion and assure the client that you will pass on his her contentment with the arrangements to his her daughter. So I'm going to tell you like this. I'm very much comfortable now based on this discussion. I'm pleased. I'm happy to go home to the care home. Can you please pass on the information to my daughter so that she can be relaxed and she can enjoy the trip she deserves? Definitely, sir. I will share your feelings and I will express. I will pass on the information to your daughter. I'm also content with the arrangements at the care home. Of course, your daughter will be informed regarding your feelings. To frame your provision, I need to know your desirable feed and any allergic reactions. In addition to that, your sleeping hours, so I can implement to make your stay enjoyable. Points are good, but sentence is cut. In addition to that, your sleeping hours, there's no verb, there is no subject also. So just you can modify those things. We have mentioned your daily routine. So according to that, we have discussed your daily routine. We have discussed your daily routine. So according to that, we are gonna. This is informal style. We are going to make, we are going to make your care plan. We will also inform your daughter about your routine. His daughter already knows about the routine. We will also inform that you are quite content with the program here and the arrangements also. To summarize our conversation, I noted your preferences in my record and I'll forward to the care home and your daughter. Yes. Then the conclusion. Write down your conclusion. To summarize, I have noted all the points and I will pass all the information to your daughter. Yes, conclude. This is to let you know that your daily routine and medication regimen has been captured. They will be communicated to your daughter. Daily routine and medication regimen, she already knows, daughter. So you need not communicate about his daily routine and to his daughter because she already knows. Nah? She is his daughter. Your consent and your happiness. So I strongly believe that I have given you the relevant information, necessary guidelines, and appropriate measures to the best of my knowledge, wisdom, and experience. So far, we have discussed your preferences, spelling mistake, ENCA, and routines. I will notify all these to the care home and make an individualized plan. Yes, people don't understand that we are in a class also. Yeah, last 3 minutes. Conclude this session. So all these sentences, I have given some corrections also. We can discuss this one. Yeah. If anybody has anybody is writing, write down only 30 seconds more and submit. Then I will close the session and I'll copy paste the document. 20 seconds more. 10 seconds more. Yeah, there's the closed. Yeah, if anybody has anything to post, no problem, post it. 10, 9, 8. Hafsa, query spelling is mistake. Okay, 7, 6, 5, 4, 3, 2, 1. Done. Discussion closed. No, that is wrong, Hafsa. Somebody help her. Yes. Yeah. So it has become 25 pages. Wow, wonderful. That's wonderful. Yeah, 25 pages notes. Okay. So I'm going to give it in the Telegram channel. Yeah. All the sentences are here in the Telegram channel. You can take and you can improve those things, right? And we are going to discuss your sentences. We are going to discuss these sentences, right? So, so how was the debate? Okay. I mean the practical part. So your participation, I mean your participation. How was the participation? Just give your feedback. We are learning, yeah. We are learning from many others. We'll get more points. Again, all the sentences are posted in the Telegram channel. You can take them and you can improvise those sentences. You can add them to your own practice. Okay. So now it is 9:53. I'll schedule these corrections later. Now, next part. Shall we go for a writing task, or shall we go for a writing task? I'll take one letter and I'll explain you. Is that okay? Yes or no? If you say yes, I'll schedule the session. Sentences, how to write sentences. I'll teach you. Sentence construction, paragraph, organization, everything. Then I'll schedule the session and I'll send you a new link. Shortly, I'll send a new link for writing shortly. Yes, see you again in the next session.